Good evening, ladies and gentlemen, and welcome back. Welcome back again to another session of Speak Your Mind. Tonight again, as usual, I'm starting the show. So I want you guys to do what I usually ask you to do. Get on the phone, call your friends, let everybody know that the Speak Your Mind show is on. Of course, this is a show that comes straight in your bedroom, your living room, your kitchen. We try to encourage you, and I try to encourage you guys to, this year, to get more involved with the show. Get more involved with your community. Be the change that you want to see. That was my challenge the last time I was on this show 2 weeks ago. And that's the challenge I'm putting out again tonight, moving forward. Be the change that you want to see. Whatever you want to see in government, in your community, in your schools, with your kids, with our kids, you know, with the community as a whole. Let's start with ourselves. So give you guys a little chance to you know, settle down and you know, call folks so they can settle down and start turning channel 55 on. Of course, channel 55 is probably the hottest channel out there right now in the BVI. So do what you got to do. Tonight, ladies and gentlemen, I want it to be engaging. We're hoping to have the folks who are responsible for the National Health Insurance Scheme to be on the show later on. So I want you guys to start getting your pen, your paper, write down your questions, your concerns. There's a lot of questions surrounding a National Health Insurance Scheme. If you've never been involved with anything such as this, I think it's a wonderful idea. But of course, like everybody else, I got questions, I got concern. How is it going to be paid for? How much money you got to come up? Who's you know, who's going to be eligible to enroll? And there's a lot of questions, and I know you guys have those questions. So if you want to call me early or send some text in early so I can document those questions for those of you that like to hide behind the phone, I understand your situation, no problem. Send those questions in. At least that way we'll have the questions already piled up, and when the folks get here, we can just start hitting them because it's important. And what's nice about them coming on the show tonight is that at least we can put faces to the program. You know, because sometimes, you know, there's always things happening in the community and you don't know who's responsible, and you see people all the time and you like to be able to have follow-up questions or maybe just ask some simple things about the program, and you'll find that sometimes we can get through things a lot quicker when we're able to put faces with programs and schemes. So again, tonight we're going to have the people from the National Health Insurance Scheme. I'm hoping they come through. Right now they're on another program. They've been working in overdrive for the past few weeks. As far as I remember, I've been listening to them on several programs and shows trying to unveil this new scheme, this new program, this new idea. So it's a wonderful thing. It's a good idea if we can have some national insurance that you know, it's affordable. It'll cover you, you know, pre-existing conditions. You can probably get extended care if you need to go off the island. But most importantly, I would like to see an insurance scheme that I believe the hospital eventually will be able to provide most, if not all, most of the service and care that we need. You know, I know I heard the Minister for Health mention something about looking to partner with places like Panama, hospitals in Panama, of course Puerto Rico, and I'm hoping maybe Cuba, and we can start having doctors from those areas that could come into the territory to deal with special cases, and that way they'll have the facility here. Next week we're hoping to have the folks who are responsible for the hospital and the clinics around the territory. So you see there's two different things going on. We got a National Health Insurance Scheme, and we got the folks responsible for our daily health. We have Ms. Baptiste, and I believe Mr. Klein will be on the show. So I want you guys to tune in next week as well. God's willing, I'll be here, and we're going to put forth those questions. And if you want to email me questions throughout the weeks that you want to ask, or you have concerns that you want to bring forth, sometimes it'll help if I already have that information. And before the show is out tonight, I'll give you my email contact, and you can all send me those emails. All right. So I'm hoping most of you guys are already sitting down, relaxing. You know, a lot of you tell me you like to hear me speak. It's not about me, ladies and gentlemen. I've been telling you over and over and over. When I come to the show, I don't come with an agenda. I come with some topics that I want to be able to carry the show until, you know, you guys decide you want to call or you send some text. I've already seen 3-4 texts there already. And then we could move forward with the show. But the show's about you. The show's about you folks. You gotta get involved with what's happening in your community. And again, my challenge this year for all of us is don't wait until something hits you personally and then you want others to fight your fight. How about you helping others fight their fight, even though it may not personally affect you at the time? Because eventually it will. At some point something will, and then you're going to feel like a loner out there. And we're not talking about going out and pulling up, getting up in arms and going crazy. We're talking about using common sense. We're talking about things that are affecting the masses. If something is affecting people that drive into Road Town, but just because you don't drive into Road Town don't mean you can't be proactive and take part in the discussion. So eventually when you do decide to drive into Road Town, at least, you know, we already deal with the problem. So I want you guys to get involved. We all need to get involved. We got to get involved with our education. We got to get involved with our health. We got to get involved with our economy. You know, a lot of problems in this country simply because we're not proactive. We're not taking part in having discussions. So tonight, I basically want to throw two things out there. I want to talk about the debate, the challenge that one minister posed to the opposition minister. I want to get you guys' take on that. But not just the debate or a fight, but the fact that we finally get a chance now, we, the community, the people of the British Virgin Islands, to actually see ministers engage in meaningful conversation where you, the audience, can really see who got your best interest at heart. You know, that's what I think this should be about. You know, so I put the challenge out there that this show, because I know we have the best people watching the show. I know that it's only right if it's a national debate. This show can reach pretty much every household as long as you got a TV or access to the internet. You know, and I know you guys would agree that if they really want to have a meaningful discussion, come on this show. And I think each and every one of you, whether you're for or against the government, you're with the opposition or not with opposition, you could talk to them, they're human beings, and say, hey, you know what? We'd like to hear you guys debate. And I'm putting it out there that they can come with whatever questions or comments they want to be able to talk about. They could put that up front. Each other can know exactly what each other is bringing to the table. And that way you can have a sensible gauge of the conversation. So, you know, again, talking about a debate. But to add to that, what I would like to see, and I think it's great, and I want to commend the government for the action they're about to take on I call it the road show. You know, where you go to the different communities, you engage the people in the community, whether it's a district or not that you won during the last election, but at least the people in that community now will have a chance, and I'm hoping this is exactly the platform, will have a chance to put forth arguments, conversation that's affecting them in that community. You know, I think as a government, whether you win that district or not, money should be allocated. If you don't want to give it to the local rep, then you go ahead and take care of the work. Take care of the people's needs. And too many cries now over simple things like water, and that's one of my topics I'm going to touch tonight. Too many cries over things like, you know, infrastructure and roads. We've heard several times over and over and over again about all these things affecting the neighborhood and the community. So I think it's great that the government is taking that leadership role. Finally, it's only been a year and 3 months, or 4 months, 5 months. going on 5 months, a year and 4 months, 5 months, that we finally get a chance now to interact with the government. It's like campaign all over again, but it's great. I think it's the best thing ever, and I would like to see, I'm going to try to make it to the one in East End, because I think it's important when we as a community are able on a regular basis, not just once every 2 months, once every 2 years, but once a year or twice a year, you know, where we're able to get with the government officials and basically, you know, tell them how we feel. Tell them how we feel about the governance. Tell them how we feel about what they're doing and what they're not doing. Tell them how we feel about them hiring their friends or their family, and then other folks in the neighborhood can't find work, or whatever the situation might be. Whatever your complaints are is what I'm talking about. I think it's great that you're able to get with these politicians and basically tell them, you know, what's happening, what's going on in the community. Because sometimes they, you know, they see it, but they don't see it. And it's great that when we could come and pretty much hold them up and hold them accountable. So to the government, again, for just so nobody don't mistake what I just said, I commend the government, because I think it's a good idea. I think it's great that they're going to get into the community, go out there and interact with people, you know, get it from the folks in the neighborhood, what's affecting them. I think it's the best thing ever, and we need more of that. And I want to encourage you folks, whether you're for or against the government, I want to encourage you to continue to in talk and dialogue with the politician and tell them this is exactly what needs to happen on a regular basis. You know, because that's the only way you're going to move the country forward. There's so many little things that are affecting the communities. You know, employment is a big one right now. I don't know how some of you feel, but somebody told me, you know, the employment rate is actually high in the BVI, but because we don't have proper reporting, proper statistics, sometimes you don't even know what's going on. But then you see a lot of people hanging around. And I just read and I saw and I listened to one of my good friends from another show said that there's too many folks just loitering, just hanging on corners, you know, and a lack of government intervention, a lack of government, you know, political strength, willingness to get out there and do the right thing. If you're in this country and you're on work permit, or you're just sitting around and you don't really have any you know, guarantee work, then that shouldn't be allowed. You shouldn't be allowed to fester. But again, if the politician don't take a stand, you're going to get nothing done. And then the politician have to set the policies, and the policies will trickle down into the folks who you know, go out and execute policies. So that's what we need. We need people, more people who are vigilant. So I think it's great that somebody else is recognizing that, you know, we got to do something. Something must be done. Employment is huge. Unemployment is huge in this country. We can't afford to have all people out of work. Whatever needs to be done, we got to do it. There's areas that we could have stimulated in Rotown, a little cleaning up, fixing up Main Street. You got a little money set aside. You got some folks you need to pay. If you could pay them half of what you owe them and take some of that extra money and employ folks and empower some other folks, let's think about some of that, you know. I think it's necessary. But I'll leave that open. Ladies and gentlemen, I'm going to tell you right now, the phone is open. The phone lines are open. I don't hold back. I want to have you guys get in early on whatever is biting you, whatever is bothering you in the neighborhood, whatever is your issue, whatever is your concern. You want to get in, call. I don't care. Call now. If you want to call and give some questions for the folks that are coming on, hopefully they'll be here by 8:15. You could do that too. Again, I got 6 texts now. I'm not going to get to the text till a few minutes, but if you want to call, go ahead and call. My biggest gripe that I want to throw out there is about this water. You know, every week now, it seems like you turn on the news, there's something about water. People are complaining about water. And I'm going to say to you folks who are complaining, I'm going to say something might be a little touchy, might be a little controversial, it might be a little personal. I don't know. I don't know how you're going to take it, but it's how I see it. And I like to shoot things straight. I think the best way is to shoot things straight, and how it's settled, it's settled. This whole thing about water, you know, one of the government ministers made a comment. He made a comment the other day, and I gotta tell you, I gotta tell you, and listen carefully, because a lot of you like to twist my words. Listen carefully. The minister suggested that folks should try to revert back to the old way of capturing water, your cistern. And I couldn't agree with that fella more. I think what that fella said was brilliant. And I've been saying it even with the last government. I remember going to a meeting at Maria's by the Sea, and water was something that was on the agenda. People were complaining, I can't get water in Road Town, and this is just absolutely unacceptable. We complained about the Barker's Bay plant. We were talking about water. Water was a major problem. Can't get water supply, government water supply. And I remember getting up in that same meeting and I made a suggestion. And I'm going to make that same suggestion tonight. Why are we continuing to completely depend on government water? If you have a cistern, and I hear some of the arguments, and I know you're going to hear the arguments tonight, people want to say, I'm not thinking straight, or it's so stupid, it don't make any sense, but we're going to examine those things. So when you call with your opposition or your opposing views, don't call me stupid. Just tell me you don't agree, and then bring me some solution. Bring me some different ideas if you think what I'm saying is absolutely off the wall. Why are we dependent so much on government water? If you have a cistern and you have government water, why don't we tap up our cistern? Tap up your cistern with the same government water that you're dependent on every day. No, I think it's a brilliant idea, and I'll tell you why. Some people say government water ain't so reliable, it ain't the best water to use, it have problems with your irrigation, your piping and so forth. It'll destroy your pipes. You can't cook with it, you can't this, you can't that. Now, for the people who don't have a cistern, they depend on government water for pretty much everything. They wash with it, they cook with it, they clean their skin with it. Some do drink it, not all. If you don't drink it, it doesn't apply to you, but some do. No. There's all kinds of technology out there that's available to you if you were tapping into government water, which means if you live in a brand new apartment, the water is running directly to your apartment bill, and you go to the water and sewage and you pay your own bill every month. I got a problem with that. I think people, whether you're living in an apartment building, whether you're living in a private house, if you have access to government water, you should tap up your cistern with the government water. You can use devices such as the one they have in your toilet bowl, so when the water drops to a certain level, it automatically turns on the valve, it taps back up your cistern water. You have water there even if government water is not coming. If you don't want to use the water for drinking, no problem. We use it every day for cooking. If you want to buy a Brita system to put on your faucet so you can drink the water, what's wrong with that? I can't understand. Every time I hear people complain about water, 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 and you ask yourself, why aren't you reserving so when you don't have the supply, you always have that reserve? To me, it's the smartest thing. The smartest thing. No. For some of you that are sitting back saying, what is Momo talking about? What is this guy talking about? That water ain't so good. You can't really drink that water. You can't really... I disagree. Again, most of us who are on government water, you bathe with it. Water going on your skin. So if it's bad for you, you shouldn't be bathing with it. You wash your clothes with it. If it's so bad for you, you shouldn't be washing your clothes with it. You cook with it. If it's so bad for you, you shouldn't be cooking with it because it goes into your food. When you boil rice with that water, the water goes inside the rice. And that food goes in your body. So if it's so bad for you, a lot of us probably would be dead and sick by now. So I don't have any problem, I don't see any problem with the government water. I think government water is just as good as any water that some of you run to the store and buy. No. Talk about buying water. A fella was having a discussion with me the other day, and the fella said to me, most people buy water to drink because the government water is not so good. So you're talking foolishness. Okay. Let me ask you guys something. Those of you who buy water, what is the process for cleaning our water? Do you know? Whether it's the water inside puzzle, or the water shipped in by boat, or the water from the machine you go in front of the right way in the rest of those places and buy. Now I want to tell you something that a lot of you ain't paying attention to. Those machines around the island that I see a lot of people go and tap up, it's the same government water that we complaining about. A lot of those machines are hooked up to a pipe. Where is that water coming from? It ain't magically appearing. It ain't coming from no spring. It ain't coming from no cistern. It is coming from the government pipes. So you have a business, you have government water going to your business, you tap into that water, the water goes through the machine has a filtration system. Let me get this call real quick. You want to speak your mind, go ahead please. It's a live show, talk to me.
Hi, sorry to disturb you.
Yeah, no, you ain't disturbing me.
I've already mentioned concerning water to the reservoir, right?
Yes.
But my point is, I've done it before, and you find the end of the month is the same water bill coming to you. When you go into them and you start explaining to them that you're not using the government water, they still send the same bill. You understand the point? I did it many times. They even wanted to come and shut off my mail, right? So I could use my reserve to see what would be the outcome. I said, it doesn't make a sense. It's the same bill I we get all the time. I don't use it. And most of the time in the area I live in the morning, I hardly get water.
So let me ask you a question.
Same bill
let me ask you a question. So you got two concerns. You said sometimes you do the same thing. You would tap up your reserve with government water, but you got concern with the bill.
Yes.
You think the bill is a problem. That's a big concern for a lot of people. But that's something you could probably control, you know. Let me ask you a question. If you were to tap up your system or your reserve, let's say your reserve is big enough, you don't squander or waste the water. Let's say you tap it up on Monday. You shut off government water. You go outside and turn off your meter or lock the pipe off so the water go through that meter. And you run your reserve, let's say, till the following week, the following Monday.
Yeah, let me say run for a whole month.
Yeah, let's say for the whole month. You really didn't have to tap into government water because your system was full and you didn't waste the water. You're telling me that you don't have a case to go and complain to somebody that say that somebody's robbing you if you still come up with the same bill?
I did it already, even the bill come higher. I did it. The people said this with a refund meter and this and the meter is paying.
And that's why I believe people like yourself need to get together and you need to start taking action against the government. Because if you telling me you're doing things like this to mitigate the costs, and you're still finding a high bill, and they don't put the kind of mechanism in place to see this air coming to your line or why you're being charged money when you shouldn't be in charge, something needs to be done.
Even look, and I'll tell you, they got the guys them that's come and reading me now. I can't explain the water wastage. You got some places water leaking 24/7. Just below the meter where the government supposed to take part and take care of. If you don't go and make a report, nobody won't come and fix it. You're going to make a report for months. I make a report for 3 months now, nobody come. I can't find out if anybody come and do it. Nobody come and do nothing. And the point I'm making, the meter man reading the meter, this part, at least it's part of his job to relay a complaint to his authority that somebody got a leak and come look at it. You understand?
Yeah, no, I totally agree with you. I totally agree with you. But listen, let's keep on top of it. Let's keep on top of it. You understand what I'm saying? I know exactly what you're saying. There's a lot of people with that same complaint that, you know, every month.
You've seen a leak. When you go back to your base, report it, man, and take action.
Yeah, but I don't want nobody else to listen to this conversation and think that we're beating up on water sewage, because I must say, to their defense, my good friend Animal Andy, this guy worked like a hog, man. Every time I see him, he side of the road, he digging up some hole. And I must say, water and sewage, from what I have seen, they react as quick as they possibly can based on the resources they have. You understand? But I think what you're saying though holds valid, because a lot of people are having the same problem. So we got to keep on top of them though.
Yeah.
But before you go, again, the scenario I put out there, you said it's something that you probably does so often. You think it's a good idea to tap up your reserve whenever possible with government water, so you always have a supply of water, or do you think the government water is inadequate?
Yeah, the government water is inadequate in a sense, yeah, but once you get the reservoir full, you have no problem, man.
Yeah. Yeah,
right?
and that's my point. That's the point. All right, Carla.
You have a resource emergency.
Yes.
They always say that put aside something for the rainy day. You understand?
Well, of course. Of course.
Man. Thanks for listening.
Yeah, thank you for calling.
Good.
So, ladies and gentlemen, I mean, the caller pretty much emphasized what I was saying. And again, there's so many different things you could do to help in a water situation. So when the minister said what he said, you got to understand where the minister's coming from, and I support that. I've been saying it for years, and I'm going to keep saying it as much as I can while I'm on this show. But before I go any further, again, we're going to take a break. But before we take the break, I want you guys to get together, get your questions about this National Health Insurance Scheme. As many questions as you can. Send me the questions. I got some texts. I'm hoping those texts or a question that relates to that. We hope to have the people who are responsible, who are doing the PR for this new scheme. It's a good idea to have it as long as it's implemented properly and you can get the right coverage. So I have some questions myself. So I need you guys to get involved. And again, be the change that you want to see. If you're not the change that you want to see, don't complain about what's happening. All right? So we'll take a break and we'll be right back.
With Digicel 4G, discover hundreds and thousands of apps available from the Google Play Store, allowing you to do more. Listen more. Feel more. Love more. Play more. See more. Like more. Share more. Make more of every moment. 4G phones available from just $99. Sign up for a Digicel 4G data plan from as little as $1 per day and explore the Google Play Store from your Android smartphone. Put extraordinary at your fingertips. Be extraordinary. Digicel. Subject to availability. Digicel terms and conditions apply.
All right, so welcome back, guys. So, yeah, before we went on break, we were talking about, I put two things out there for you guys to just ponder over. But again, the phone lines are wide open. If you have another concern you want to talk about, feel free to do that. Phone lines are open. Go ahead and call. If you want to send some text, go ahead and text. Again, my challenge this year, and I'm going to keep emphasizing this, is that we all want to be the change that, if we want to see change, we got to be the change we want to see. So change starts right here. You know what I mean? You can't fight. You can't fight. You can't expect others to fight your battle if you're not helping to fight others, other people's battle. But so anyway, so basically I put out there three things actually. We talked about the debate. You know, there was a challenge went out this week. One of the ministers put a challenge to another minister for a national debate. I want to get you, I'm soliciting you guys' help to get this out there. I think it's great. I think it's great when we can get government officials and ministers to get together, come on a national scale, and basically get in front of the audience so people can talk to them and put questions of concern that relates to the country. We also talked about the water woes. I put out some idea, one idea. My idea is just one idea, but I keep saying that, you know, if we, and when you really look at it, we went from a self-sufficient way of collecting water you know, doing our own business with it. Some of us had small cisterns, some of us had drums and things that we used to store water in, and when it rained, we conserved the water, and we always had a supply. If we were low, we told our kids, you can't take, you know, 5-minute showers. You just had to conserve. And we got to a point where we got about 5 to 6 desalination companies in the country. There's a lot of them. We got 3 or 4 of them on Tortola alone. We got government pipes all over the place, and a lot of us, not everybody, but a lot of us have converted from an old way of reserving and collecting water and dependent entirely on government. And then we run out because there's issues with the supply of water from the government installation, right? So my suggestion, and the minister just this week suggested that people should resort back to that method of cistern, you know, reserving water in your cistern and depending a lot on that. But I say, yes, I support that. At the same time, use government water to continue to keep your cistern at a level. Shut off government water when you don't really need it, and then you have your supply of water in your cistern. Or you put a control system in there. The same thing you have in your cistern, they have those in a commercial setting, where you can put it inside your cistern. If your water drops below a certain level, it fills it back up to that level. So when the government water is on and your cistern is low, it fills it back up. When it gets back up there and government water goes off for some reason, a day or 2 days or overnight, and you really need to flush your toilet or maybe make a hot cup of tea, you still have water in your cistern. If you have a problem using the water for drinking, they got systems, things you could put on your faucet, like the Brita system that you could put on there, and it filters that water, it cleans that water, and you could use it to drink it the same way you drink cistern water, which sometimes is a big problem as well. A lot of you think cistern water is so clean and it's so pure. It isn't. You got a lot of disease and things that go in your cistern. These roaches, you got lizards, you got birds that you know, do their stuff at your sprout, and then that water goes in your cistern and you're not even thinking about it. So the same way you got to treat your cistern water, you could treat the government water going into your cistern, so you always have a supply of water. Those are just some suggestions. If you think you have a better idea with the ideas that I'm putting out there is crazy, then share some with me. Share some with the other people who are listening, because if you do that, if you resort to that type of storage, 90% of the people out there, 90% of you out there who are complaining every day about not having government water, you're always going to have water. You won't have, and I heard some horror stories recently that people now are actually filling up buckets when the water do come on for the 20 or 30 minutes, filling up buckets and now having to bathe in buckets again. I mean, this is where we're going. We're not going far. We're going backward. But we can set ourselves up for success, and that's all I'm saying. If you got a different idea, share it. A lot of you say, you know, again, I had a debate or discussion with a really smart guy this week, and the guy said something about that's why so many people buying water, because the water you buy is so much better. Well, my friend, you know, I didn't want to really bust his bubble. But a lot of you are buying water from these machines, and the machines is a process to filter and clean the water, take whatever impurities out of the water, put it in bottles, and sell it to you. But where is that water coming from? The same water is coming from government pipes. So if I'm wrong, correct me. If I'm right, share some information. But anyway, so again, the last thing is we have some really smart people coming on tonight to talk about the National Health Insurance Scheme. I'm not sure if that's the right word, but it's a scheme nonetheless. It's an idea, it's a process, it's a program. Hopefully we're going to take a break in about 30 seconds. And hopefully we'll have them on. And if you didn't send your questions in, send your question in when we take this break. I do have about 5 or 6 questions, so we're going to open up the discussion with them on these few questions that I have. So stay tuned. We'll take a break and we'll be right back.
With Digicel 4G, discover hundreds and thousands of apps available from the Google Play Store, allowing you to do more. Listen more. Feel more. Love more. Play more. See more. Like more. Share more. Make more of every moment. 4G phones available from just $99. Sign up for a Digicel 4G data plan from as little as $1 per day and explore the Google Play Store from your Android smartphone. Put extraordinary at your fingertips. Be extraordinary. Digicel. Subject to availability. Digicel terms and conditions apply.
All right, so welcome back, guys. So like I promised, we're going to have some folks in the studio tonight to talk to you guys and give you a little bit more information on the National Health Insurance Scheme that's up and coming. Again, like I said in the beginning of the show, I think it's a wonderful idea. We all need health care. We all need some kind of insurance or some kind of guarantee. Before I introduce them real quick, I just want to say I got a text just now, and the text was real straight up. A lot of folks are into health. They're exercising. You're on the street, you know, early in the morning, 4 o'clock, 5 o'clock, 6 o'clock in the morning. You're exercising on some of these public roads and they don't have any sidewalk. We're asking you folks, while you're exercising and trying to take care of your health that way, think about your personal safety. People are asking that you guys wear things that reflects your body, your movement, and so forth. Reflectors, put them on, find one, buy one. I think that somebody sells them around here. And I think it's a really, really good idea because a lot of people like me, as young as I am, we're losing our sight. And we're having a difficult time seeing you guys when you're wearing black and dark blue and you're doing a good thing, but we can't see you. And some of you are walking 2 and 3 next to one another and you're in the middle of the road. Pay attention to the street, folks, especially when they don't have any sidewalk. And if you're walking with your back turned to traffic, that's a dangerous thing. I was always taught that you walk towards traffic. All right, so without any further ado, again, I do have a few texts, but please, this is a chance to call in. It's not a political thing. You don't have to worry about somebody calling you and hearing your voice and might look to fire you tomorrow or Monday or Sunday. This is about your health. And these are people, are really nice people. They bring in good information about something that all of us need in the future. So without any further ado, ladies, please introduce yourself.
Good evening. My name is Antoinette Skelton. I'm the Director of the Social Security Board.
I am Kishma Barronville, Manager of Beneficiary and Advisory Services for the National Health Insurance.
All right, so National Health Insurance, right off the bat, ladies, just tell us exactly what we're getting ourselves into. What is a National Health Insurance? Why is it important?
I'll take that. National Health Insurance is a mandatory...
Wait. You wasn't expecting that question.
I was expecting it, but I thought Ms. Barry would take the question. We expect any question. We're prepared to answer any and all questions.
Okay.
It's a mandatory contributory insurance system that will provide access to all legal resident member of the population. Access to health care. You said mandatory. Obama said something about mandatory health care. If you don't buy it, there's a penalty. Is there anything like that going on right now? When you say mandatory, who are you referring to? It is going to cover every legal resident in the BVI. There will be the only penalty that you would have if you're not a member of the system is that you won't have access to health care.
So mandatory would mean people who are legally employed, gainfully employed, just a resident of the community. You know, when I think of mandatory, it's mandatory that I have insurance for my car. Is it mandatory in this sense?
It is mandatory in that sense, so that you can have access.
So
it's all legal resident, everybody in the BVI who is living here legally.
Okay. So everybody's required regardless.
Everybody, yes.
Tell us about cost. That's always a big thing. Let's get to that because that might be the debate tonight. Cost. How do I enroll and what will it cost me?
It will cost you a set percentage of your salary.
So I must be working then. What if I'm not working?
If you're not working and you have other sources of income, for example, rental income, if you have some source of income. So salary was a bad choice of word income.
Okay.
It'll be a certain percentage of your income.
So let's get that straight, just so people listening don't get it confused. It's a mandatory program.
Yes, it is.
For every legal resident of the BVI.
Yes.
Don't matter who you are.
No.
As long as you live in the BVI, you're going to be required to enroll.
You'll be required to, yes.
There's a cost. It's cost based on income. It doesn't necessarily mean if you're working, but some sort of income.
Right.
If you're declaring an income of $1,000 a month, it's a percentage of that. That's what you're saying.
Percentage, yes.
What is that percentage?
Well, we don't have a percentage as yet. We have a recommended percentage based on the financial model that was done by the actuary, but that's a recommendation. The government will decide the percentage.
Okay, but could it be 20?
No.
Could it be 15?
No.
Could it be 10? Could it be 5?
It's going to be a reasonable percentage.
Based on the actuary model that you already have in your possession, what gauge, what should be people reasonably be expecting?
I don't want to preempt government from making this decision.
Okay.
But you asked about 10 and 20. It's going to be lower than 10.
Okay. Because I tell you something. Again, cost is probably going to be the biggest debate. Can I afford it?
It is affordable.
It's affordable.
Yes.
Ladies and gentlemen, you heard it for yourself.
It's
affordable.
affordable. Yes.
And it's a necessity.
It is a
Yes, it
necessity,
is.
yes.
It means now, when we talk about national health care, right? Now I'm thinking hospital locally, clinics locally, private practice locally, and then international coverage if I need to go off island. How does it work?
Well, yes, the National Health Insurance is intended to support local services, but we all know that services are limited in Virgin Islands, as well as there's a limitation as to what services are available anywhere in the world for that matter. So we know our limitations currently, so we will seek to enroll persons within the provider network of the National Health Insurance so that persons do have coverage off island when necessary.
So
and it must be medically necessary for those services to be accessed off island.
Let me put a little heat in this then. We here locally, we're hoping that at some point the hospital system itself will be able to supply some of our needs medically.
Yes.
Yes.
We have local and private clinics and hospitals that provide other services that our hospital currently ain't providing.
Yes.
It's mandatory for citizens to have the health insurance, be a part of it.
Yes.
Why isn't it mandatory for every healthcare provider in the territory to be a part of this to provide affordable care?
Well, the private facilities will be invited to enroll with the National Health. It is, like the word suggests, it's private medical care. So therefore, they are separate entities to government, and they have a choice whether or not they wish to enroll with the National Health Insurance. But it is free and open to all public and private health care facilities, and we do hope that all private and healthcare facilities will see this as a plan that is essential, a plan that is part of the development of the Virgin Islands, and enroll within the National Health Insurance.
All right, I'm going to come back to that, but I'm still put some heat on that because you see, you said something that was really nice. You said they will be invited and they have a choice, but as a legal resident of the territory, I really don't have a choice. It sounds like when you say mandatory for the people, it's mandatory for me to take part, to put in, but at the same time, I might find myself in a situation where I probably could have gotten a care here, but because that provider decided they don't want to be a part of it because he's not required by law to be a part of it, I might still have to incur extra costs.
No, not necessarily. While the private providers are going to be invited to join, they're at will, whether they will or will not. Coverage or access to healthcare on island, whether or not they have enrolled within the network, will not be denied. There is a possibility of a higher co-payment for those services locally, but you will not be denied access to medical care because of that.
All right, well,
but we are confident that they will join.
Okay.
Because one of the things that the National Health Insurance IT system that we install in state of the art, real time, so the doctors are not going to have to wait months to get their money. They're going to get the money quickly. So when they see the benefit, one of the benefits of this National Health Insurance is payment of claim real time. So when they see how quick it is for them to get the money, they will join.
So basically, the facilitation of funds, payment, will be centralized with government, and the claims are sent to government.
No.
So to the National Health Insurance.
So who is the National Health Insurance? Where are they based?
The National Health Insurance is a division of the Social Security Board.
Okay, so it's local then.
It's local,
but
right?
It's not okay. So we know it's here,
yes.
And they're the one going to be controlling, organizing. When you go to a doctor, you pay your copay or whatever. They now send the bill to that entity. I don't have to worry about anything else after that.
No.
And they send it electronically, and everything will be paid electronically.
Gotcha. Well, again, folks, the phone lines are open. Don't wait till when the show go off and then say, I wish I'd called. I wanted to call. It ain't political. It's about health. Tonight we're talking about the National Health Insurance, what do I say, scheme? Is that
system?
National Health Insurance System. How quick are we looking to get this thing going? How quick is it actually going to be a material product that I can touch, a tangible something?
In the very near future. Why I say that, and I'm not being evasive.
You sound like a politician.
No, not at all, not at all. The day that was set between the National Health Insurance and the Minister, of course, was August.
August of this year.
But the National Health Implementation Team and the Minister, we want a good product. We want the best product. So if August we're not ready, we're not going to launch. But the date that we're working toward is August. But that's not in stone. If I come August we're not ready, we just put it off till the time we're ready. But it won't be put off for another 2 or 3 years. It's in the immediate future. Because
I remember when this program started. I remember when the initial consultation started, there was a group of people from, I think, the University of West Indies.
Yes, HEU.
And I remember them because I used to drive them. They were staying in a house in Harspat, and every day we were back and forth. So I think it's long overdue. What happened to people who already have insurance? For example, the Bupa insurance or some of these other insurance. Is it going to be equal enough to where people could say, I don't need Bupa, this is more affordable, let me work with this have a wider coverage? Or is it, am I still juggling one set of money over here and another set of money over here?
That is a private decision for the individuals who currently have private health insurance to make. Once the NHI system has been rolled out, or even before that, once the benefit package has been made public, they can review and make that decision whether or not they believe the NHI will cover all their needs, or whether or not they feel they should have a supplemental policy.
But the program that we are putting forward, the National Health Insurance, the proposed National Health Insurance, is going to be such that you're not going to need a secondary insurance.
Well, okay, again, putting a little heat on the conversation. When we talk about choices, right? I mean, I live in the States, you know that. I live in the States for a little bit, and all the companies I work for, there was always a whole bunch of different options. I was never required to be a part of any one program. I had Kaiser Permanente, I could go anywhere. They had a wide range of people, clinics, doctors, hospitals all over the country, even in Puerto Rico and so forth. Now I'm looking at, if I'm a consumer out here and I'm with a good employer, I got Bupa. and Bupa working really well for me. It's a little expensive, but here you are coming on stream now telling me that I'm required, sounds like it's a legislative thing, by law, to now take part in the National Healthcare Insurance Plan. What is the consumer supposed to think?
The consumer is supposed to think, we're going to assure them that the National Health Insurance is a much better plan than what they have now. But what we have to realize is that persons do not necessarily plan for when they, for these kind of eventuality. I think we need to realize that I was saying 40 earlier, and somebody corrected me, about 50% of a local walk-in population are not covered by any kind of health insurance.
All right, hold that comment. Let's get to the phone. I think we got a brave caller. You're welcome. You want to speak your mind? Go ahead, please.
Yes, good evening. Ms. Barrow said that those who have Bupa insurance will have a private decision to make when it comes to their product and the insurance. But she has to remember that government covers the civil service. So what will happen then? I'll hang up and listen.
The government employees will be covered by the National Health Insurance.
So that's automatic?
That's automatic.
All right, Carla. So basically what she just said, if you're a government employee and you're already being covered under Bupa, under the National Health Insurance Scheme, program, you will automatically be covered.
Right.
That's right.
So if they still want to maintain Bupa though, is that a choice, or
if the individual wants to do
that?
If the individual wants to do that, because government is not going to pay, and no employer is going to pay two insurance for one staff.
So is government paying for government employees to this new healthcare plan?
The proposal is that the employee will pay 50% of whatever it is, and the employer will pay 50%.
What is it? What is the current standard right now with Bupa?
I think it's shared. I think
It's
the contribution
50-50?
is shared. The premium is shared.
All right. So if you are here on Bupa, tell us exactly what your payments are, how it's being sorted out between you and government, and we'll clear that up. Let's get to this next call. You want to speak your mind? Go ahead, please.
Yeah, good evening.
Good evening. How are you?
I'm good. Sir, I'd like to ask the ladies a question.
Sure.
The National Health Plan would be some sort of subsidiary of the Social Security.
It will be.
And so if the National Health become overburdened, would that in any way compromise your Social Security benefits? I'll hang up and listen.
Sure,
Right.
thank you.
Give him 2 seconds to hang up. All right, Carla, thank you so much.
What careful attention is being taken is that the National Health Insurance does not compromise the Social Security. The funding will be accounted for separately, and if the Social Security Fund will not be part of the National Health Insurance or vice versa. But what we want to assure the public is that we had an actuarial study done, and we expect at the end of every year to have a reserve. At the end of every year, to have a reserve for investment for future claims.
Is there a cap on the type of insurance you can claim or medical care you can seek with the new insurance plan? For example, if I need special surgery on my eyes,
Yes.
and I have to go to Florida, and it costs me $30,000, is there a cap on that?
There's
No.
Go ahead.
Secondary and tertiary care will be required to have a referral system. It will be part of a referral system.
Yeah, so
We will
Dr.
have
O'Neill would refer me to that clinic, give
Yes.
all the evidence.
Yes, and the NHI has a separate committee, the Medical Review Committee, who will review all referrals from your physician.
All right, hold that thought. Hold that thought. You want to speak your mind? Go ahead, please. Hello, it's live show. Talk to us.
I wanted to ask a question. Okay.
Sure. Speak up just a little bit for me, please.
I think the health plan is a good move, and we welcome it.
Thank you.
But for a resident that lives here and already have an insurance already.
Carla, just speak up a little bit. They said thank you lastly, but you said but, so we didn't hear after the but.
Okay, I would say to you now, for someone who already have an insurance, right? Does it necessarily mean that that person has to give up that insurance to go on the government one, or is it a choice of your own?
No, that's what she said. You will be required to get on government health care plan. That's number one. But if you want to maintain the one you already have, in addition to the one you're required to have now, that's up to you. That's between you and your household.
But you'll be paying for the same benefit, you'll be paying for the same coverage twice.
Twice. You understand that?
Oh.
What they're hoping to accomplish, and I think what they will accomplish, is that they're going to have the entire territory covered. They're going to have such a wide, and we're going to talk about coverage. We're going to have an in-network group of people that is going to be so good that you will need to have a secondary insurance. You understand what I'm saying?
Okay.
So basically, that's the whole focus.
I'll be the first to endorse that. That's an excellent move.
Okay. Well, make sure you sign up. Well, you ain't got no choice.
I will.
All right. Thanks a lot, So basically, yeah, tell us a little bit about coverage. I mean, I just jumped the gun on that because I like to talk so much, but I'll let you guys do your thing. Sure. Coverage, local coverage, international coverage, in-network coverage, out-of-network coverage.
Yes, the NHI will cover.
Stop.
Yes.
We must give them a chance.
Yes.
You want to speak your mind? Go ahead, please.
Yes, good night, Sam.
Talk to me.
Yes, sir. To the panel, right? Question. Putting into risk officers. That's police officer, fireman, immigration, customs.
Government worker.
Yes. But they are risk officers now. But they have to pay that 50% into that system compared to now where they open thing.
We can decide that. That's a government decision. That's a government decision. We know that there are some workers out there that government pay that entitled to free medical care. But if you would recall, if you heard the speech from the throne last time, said that government is looking at the mandated population with a view to amending the legislation. I don't know what the end legislation would look like, but that's not a call for NHI. That's a call for the government.
That's a policy.
That's a political decision.
Yeah, but that was a really good call, though, because that was something I wanted to put on the table. And I remember the speech from the throne, and I actually read it when the governor spoke about that. You know, prisoners, prison workers, police, you know, fire, amending some of the laws to make sure that those guys are covered. Again, we were talking about coverage. Give us a little background on that. What does it mean?
Primary, secondary, and tertiary care will be covered by the NHI. Yes, there will be a local network which will include all of public health, including hospital and clinics, and we hope to have all private local healthcare facilities and doctors, as well as for services that are not available on island. We will have an overseas network. So,
okay, hold on, Todd. First of all, explain to the folks, what is primary care? What does it mean? Primary
care essentially is you're not feeling well, you go to the doctor, you have the flu, or you go to the doctor for a general checkup. First attention. Okay. And after that visit, you find out it's not the flu. I actually have a brain tumor.
So I gotta go to the hospital.
So therefore, that secondary care you're entering into, and you need diagnostics. You might need a procedure to alleviate whatever situation you're having right now. And if it requires major surgery or therapy, then you're going into tertiary care.
Okay. All right. When you go to the hospital, sometimes you find yourself, you know, the extra cost is always these tests. You take blood, and it's like 10 different tests you got to take. When they start itemizing those, it comes up to $600 and $800. When we come back off the break, I want you to hit that for me.
Sure.
Tell me, people want to know, is this thing going to cover the entire care?
Yes.
Folks, we're going to take a break. We'll be right back.
With Digicel 4G, discover hundreds and thousands of apps available from the Google Play Store, allowing you to do more. Listen more. Feel more. Love more. Play more. See more. Like more. Share more. Make more of every moment. 4G phones available from just $99. Sign up for a Digicel 4G data plan from as little as $1 per day and explore the Google Play Store from your Android smartphone. Put extraordinary at your fingertips. Be extraordinary. Digicel. Subject to availability. Digicel terms and conditions apply.
All right, so welcome back, guys. If you didn't catch the beginning of the show, again, we're talking with the folks who are responsible for selling us on the idea of the National Health Insurance Program coming online. It's a really good idea, but folks, the texts are good. They're really good, but they're long, and you can ask these questions by simply just calling real quick and putting it out there. But ladies, before we went on the break, we were talking about the testing that you have to take when you go to the hospital. Are they covered? Number one. And then somebody asked a really good important text. They sent a nice text. They said, what if I'm not working? Am I being penalized like Obama was trying to penalize people in the States because you ain't working but you're still required to get this thing? How does it work if I don't have a job? What if I'm a school child or underage or just can't work?
Okay, children between the age of birth and up to 25 years, if in full-time education, will be paid for by the government.
So any child who's in college, yes, up until age 25, right, he is covered by the government.
Right.
So he doesn't have to pay, he or she doesn't have to pay.
He doesn't have to contribute.
But what about I'm 26 or I'm 20 years old and I'm not at college and I just ain't working for whatever reason, but I need health care?
Well, the Social Development Department will determine, and you have no other source of income, and you have no source of income?
No, I'm sitting on the corner all day long. I'm sitting on the corner, I ain't doing nothing. I just finished, I got kicked out of school because I was a bad kid, but I'm looking for a job, I ain't got no work. Okay, so the social development, because indigents will be covered for by government, so the social development will decide whether that person is an indigent or not. All right, so testing is covered. Emergencies, again, we talked about this off air just now. People dealing with emergencies, you got a situation, somebody asks, why do you need this committee in place if that's going to be a hindrance when people need quick service? They got to get off the island, they got a referral from the hospital because they're in the hospital and they got to get out of here. The accident happened today, they need to be out of here by Monday, Tuesday.
The Medical Review Committee will be equipped to handle emergencies. And emergencies, they do happen. We sometimes cannot avoid them. So each person that is a member of that committee will be fully aware of where the limitations lie and what decisions they can make in terms of getting a person off island expeditiously so that they can access the health care that they do need. But one of the things that would happen is that the National Health Insurance will be working closely with the Health Services Authority. And that's the hospital? Or people who run the hospital or the clinics? Or yes, the Health Services Authority. The guys who will be on next week. Well, let me ask you this then. I remember going to Dr. Penn's office one day just to get some information and get a checkup. And Dr. Penn, he's online with a network of doctors throughout the United States and different parts of the world. And everything that he did with me, it was online. Is that also going to be a part of this
new insurance plan, if I have to leave the island for an emergency, is my care that I had here is available to the doctors there, so I don't have to go through all this FedEx and stuff?
We're going to have a state-of-the-art.
You keep telling me state of the art, you know.
Yes, okay, so
you know,
to make it brief, yes.
Today, you know, we were supposed to have a state of the art immigration process, and we still can't tell specifically, and I'm not beating you up, you understand what I'm saying? We still can't tell year by year, day by day, week by week, exactly how many people came into this country and what port of entry they came into, you know. So moving forward, I'm really praising this program, but let the people know straight up. I mean,
I'm letting them know straight up. Social Security, National Health Insurance is a division of Social Security, and Social Security has an excellent track record, if I might say so myself.
Last question. Why should anybody join? I mean, yes, they don't have much choice. That was a text. Why should I join if I already have good coverage? We covered that earlier. Obviously, this person didn't hear us. Why should I join?
And persons, like I said before, there are a significant number of persons who do not have insurance. And if we were to segment the population and say, okay, government is going to provide national health insurance for part and private insurance provided for the other part, you know what will happen? The private insurance will take the good risk and government will be stuck with the bad risk.
Let's get hold your thought. You want to speak your mind? Go ahead, please. It's a live show. Talk to us.
Good evening.
Again, thank you for calling.
Okay, fine. Ladies, will there be any ceiling to the cost of whatever the ailment that the health insurance would cover? Or will they be subjected to whatever the various institution or personal doctors charge?
We're negotiating with the doctors. There'll be a fee that we will pay the doctors for per service. It'll be fee per service.
Well, I think he was saying whether there was going to be any variances. Like, for example, if a doctor submitted a bill for $1,000 for a particular type of service, if you were going to have any variance with it, whether or not you were going to have a cap on the amount that you would pay for that particular type of service.
There will be a cap. We're going to agree with the doctors. For example, a fee schedule, right. And the doctors cannot charge outside of that fee schedule.
Exactly. Control costs.
So the can't say National Health Insurance paying $10, so we're going to charge a patient $5. Can't happen.
All right, let's get to this call real quick. You want to speak your mind? Go ahead, please.
Hello.
All right, talk to us.
Yeah, good.
Turn on your TV just a little bit if it's up.
My question is that what is the age ceiling with regards to contribution on the insurance scheme? In other words, just like how you pay Social Security, and at 65 you get your contribution back. You're no longer working and you're no longer paying any contribution. Would you be still eligible for coverage, full coverage, even though you're not working?
The NHI program covers you for a lifetime, from 0 to the time that you are deceased, as long as you are an enrolled member and have paid your contributions if you're a working person, or if you're a senior and you are part of that population that the government will make contributions for. The requirement of the enrolled members now would be for them to inform the NHI when their circumstances change. If you're not employed for a short term, you will be expected to inform the NHI of that so that we can make interim arrangements with you. If you simply do not have a job, then you would need to make arrangements with the social development so that you can be classified as an indigent person, and then government will make those contributions for you. The intent of the program is to ensure that legal residents do have coverage that is continuous.
So, in other words,
did you get a caller?
Yeah, there's one other quick.
Go ahead. No, take your time.
If I have reached retirement age and for whatever reason I cannot make any more contributions, you are saying that I will be still covered by the insurance scheme?
Yes, you will be.
Yes. Pensions, now you're of retirement age, you mentioned your Social Security contributions. Those, you will not be required to make a contribution to NHI out of your retirement. If you do have, however, if you do have additional income such as rental or investment income, you will be required to declare that, and depending on the level of that income, you may or may not have to make contributions to the NHI.
Okay, thank you very much.
All right, thanks a lot for the call, caller. Families and kids. I know you said kids, as long as they're full-time in college, up to age 25 are covered by the government. What happened to some of these kids that are not in college, but they're not really making any money, they're under the parents' supervision? Is the parents required to pay and take care of those kids, contribute for those kids, or are they still covered?
If they're out of high school?
Yeah.
Yes.
But they're not in college?
The parents will have to pay for them.
Okay, so even kids are required by law, when this thing rolls out, to be a part of this plan, one way or the other?
All legal residents in the BVI.
Somebody that just moved here, they're here on a work permit, they're here on a 1-year contract, 2-year contract. They're required to be a part of the scheme. When they decide, let's say in between that time, they leave and they're still working for the company, but now they move to Dubai. Are they covered?
No.
Overseas? So you must be living in the territory.
Yes.
Once you leave the territory.
What is proposed as of today is that the only persons outside who will be covered outside, the persons are students.
Kids.
Students, yeah. Students, college students.
Okay.
And if persons are away for business, legal resident, and they have an emergency, they will be covered.
Courtney, any question?
And politicians.
And politicians.
People working for the government in a political area would be covered.
Yeah. Yes.
Yeah, that's good. The one text, I want to just put this out there because the texts are probably going to be a little mad if we didn't. We got another call. Let's get to this call real quick. You want to speak your mind? Go ahead, please.
Yes, pleasant night. I just tuned in, so I'm not sure if the question was answered. But my question is, would your insurance increase every year? I know my existing insurance will increase if I go to the doctor, I do some kind of procedure, there'll be a little increase the following year or something. So would it be that case as well?
That's not what's proposed. It's a percentage of your salary. So if you get a raise, the percentage won't increase, but if you get a raise, of course the deduction will be a little more. But it's not proposed. It won't be based because you had a claim. That's what it won't be increased because of that.
It's not like auto insurance. Every time you get in an accident, they raise it.
Oh, okay. So you're saying it's something standard year to year?
It's standard based on your income. Whatever your income, whatever you're declaring to the government, it's a percentage of that.
Okay, good. It's based on your salary. So whether you
income.
Claim, it will not
income. You could have an investment. You could probably have a salary. If you're claiming all that as income, then quite naturally it's a percentage of your overall income.
Right.
Yeah, when I say make a claim, I mean with insurance company,
No, I know we're talking about what you would have to contribute to be a part of the scheme, to be a part of the insurance plan.
That part I understand, but I know with I'm just telling you my existing insurance goes. Say for instance, I did a procedure last year, and this year I see my insurance went up. First year I pay $100, next year I pay $120, next year it went up to $150, this year it's $175. Would it be a case like that?
No, the system does not seek to penalize you for utility. As Ms. Skelton mentioned earlier, the contributions, total contributions towards the NHI may change because the contributors' salaries have increased. So therefore, if you start at a salary of $10 a month, you pay a percentage based upon that. But you do so well in your job, you're increased next year to $20. So therefore, your contribution will be based upon your salary. or your
That's the
income.
only increase I would see. If I get an increase in my salary, therefore I'll see an increase in my insurance.
Right.
Yeah,
Yes.
but if you get that
But the
raise, don't tell us you
percentage-
didn't.
The percentage won't change.
No. I'm trying to keep this legit, so that's why I call it out.
You better. And make sure your friends listening keep it legit too.
Absolutely. I keep it by the book.
Thank you. Thank you so much, Carl. Good questions. That's a really good question, because you know it's like insurance, auto insurance, man. Every time if you get a little fender bender, the next year, you know, they consider you high risk. And I know a lot of times, sometimes that's the struggle people have. You want to speak your mind? Go ahead, please. Talk to us. It's a live show.
Good evening. Question: have your research shown that you have sufficient participants to carry this system?
Sufficient what?
Contributors.
Well, you
Oh,
ain't got no
yes.
choice.
Enough contributors to pay for all of this health care.
Yes, we had several studies done. We had several studies done, including an actuarial study. We studied mortality, mobility. We had all those studies done.
Okay, thank you.
You're welcome.
Well, the only real thing lacking is a census. But we can't worry about that at this stage.
No, but we know for a fact we got more than 20,000 people in the country.
One of the challenges, though, as is with Social Security as well, is the employer's contribution. So I hope we build in a safety net to ensure that the employers, you know, would make those contributions, as we do with Social Security.
Sure, there is safety net. We know that some employers will seek not to contribute, even after deducting from the employees.
Let's get to this.
That's what I was talking about.
You want to speak your mind? Go ahead, please. Turn on your radio, TV, please. Go ahead, talk to us.
Yes, for instance, you consumption. Work this week, you don't work next week. I would you contribute?
If you work this week and you don't work next week, what would happen?
Yes, you work the other week, you know what consumption is.
Yeah, you're in the construction field, so you're saying if you're enrolled this week and all of a sudden you got work for the next 2 weeks, but then things slow down, would you still be covered?
That's 2 weeks.
You pay when you contribute when you work, and you'll be covered.
Oh, okay. So no problem with the week that you ain't work.
No.
Oh, okay. Okay, thanks.
Caller, if you're still there or if you're listening, you would have to make arrangements.
Hold on a second. Turn on your TV just a little bit, caller, so you can hear really well.
For the caller just now, you would have to make arrangements with the National Health Insurance Office if the case is you're temporarily out of work, and the persons at NHI will make the access to healthcare available, but it is circumstantial, and you do have to advise the NHI of your situations so that we can make adequate arrangements for you.
Somebody traveling on vacation, get in an accident, they just left the territory, they covered?
They're covered.
Yes.
Mm-hmm.
Yes, so call, text her, you are covered. If you're leaving on vacation, something happened, you got your insurance card, you just present it like those folks who come down here would.
Yes, and if they have difficulty, like we said, that then NHI, the public will have access to NHI 24/7.
Gotcha.
So if somebody in Europe and they get in an accident, then we expect them to contact us and we'll make arrangement for them.
Right. You all speak your mind, go ahead please. Hello?
Hello?
Hi, talk to us. Good afternoon, no, good night, how are you? You got me saying the wrong thing too.
Hi.
How are you? Talk to us.
I have a question. I just tuned in, so I'm not sure if this question was asked already. Has the percentage been decided on what the employee and the employer have to pay into the NHI?
It hasn't been decided, but it'll be shared equally.
Okay, and I have another question. Let's say I'm pregnant and I'm covered by a private insurance. But let's say with the NHI, let's say I'm pregnant and I choose to go overseas to have the baby. High risk, I just choose to go overseas to have the baby. Would I be covered by the NHI?
You'll be covered as if you had the baby here.
Okay.
But wouldn't that be if they were part of a network or somebody who's part of the network coverage?
Persons are free to go overseas. We can't stop them from going. But if she goes overseas and she had a baby, say in Florida, we would pay her. She would be forced to pay the bill, and then we would refund her as if she had gone to People's Hospital.
But what if she went for medical reasons? Because
But that's different. If she's referred overseas, it'd be treated like any medical condition.
No, there's some pregnancy situations where the hospital here can't deal with.
Yeah, and she'd be and of course she'd be referred overseas, right?
Not necessarily. The person might take it on their own to seek better health care.
Carla, let me ask you this. Be specific. What is your, without telling us your business, right? You asking generally if you just wanted to go have your child overseas, would you be covered?
Generally.
So if you decide you want to go to St. Thomas and have your child there, you want to know if you would be covered in St. Thomas Hospital?
Yeah, because with a private insurance, right? Once you go to a gynecologist or OB/GYN in their network, you'll be covered. So what you pay out won't be that much. Or some insurance have, like, let's say they grant you $6,000 for your whole pregnancy.
Now, you indicated that you have a normal pregnancy. You have no health conditions.
No high risk, nothing like that.
The National Health Insurance Program is geared towards the support of local services initially.
Okay.
If those services are not available off island, then we gear you towards an approved person off island. Pregnancy, now you're having a normal pregnancy, therefore that can be dealt with on island. If you have a high-risk pregnancy and we have no facility or specialist on island that can deal with your care, of course you will be referred off island and that pregnancy will be paid for. But if you so choose to have a baby off island, now that becomes an issue of sovereignty, and that claim will not be honored by the NHI.
So you understand that?
Oh, yes, I understand completely. I have one more question. Okay, people that have private insurance, have you guys considered, okay, I think no one has a problem with the NHI. I think it's a really good idea.
Thank you.
What about, if I'm covered privately, but I pay into the NHI, would my percentage be less than someone that doesn't have private insurance?
No,
it's not covered. So everyone is paying the same amount.
Same amount.
Based on income.
But once the NHI comes on stream, there'll be no need for your private insurance.
There'll be no need at all?
Well, we want you to get rid of the other guy. That's what they really want you to do. Get rid of the other guy, because they say, I'm going to speak for them right now, they say that their coverage is going to be so good locally and internationally that you won't need to have another guy. And the guy is foreign. You don't need somebody foreign to work for you when you got your own hair locally, right?
Okay. All right, thank you so much.
Well, thanks for your call. It's a good question.
Okay, bye.
Bye.
No, I remember hearing a call on one of the other shows, I think you guys were on the other day, talked about credit for preventive care, people who are practicing, good habits. Is there any kind of credit granted to those people? Maybe they pay less money into the system but still have coverage?
Not necessarily credit in terms of contributions to the NHI, but one of the initiatives of NHI is to promote wellness amongst the community and preventative care.
Right.
So therefore the NHI will utilize such programs within the community that does such.
All right, hold that thought. Oh, okay, they hang up. There was somebody that texted us earlier. You guys remember the text? They asked about acupuncture, different type of treatment and medicine approach. Most of that is not covered, you were saying.
No.
Basically, what's covered? What's generally? Hold on. Let's get to the phone. You want to speak your mind? Go ahead, please.
Hi. Good night.
Hi. Good evening.
My question is, who will be providing the seed money on the National Health Insurance System? Is it coming from the Social Security Board or is it coming from the government?
Government of the Virgin Islands.
So is it budgeted?
I can't speak for the budget. I don't recall if it's in the budget, but government is providing the seed money.
Carl, you have some money you want to put up?
No, but I'm just trying to understand whether it is coming from the coffers of the government in terms of what kind of funding are we looking at.
Let me say, not 1 cent of your Social Security contribution will be spent towards the National Health Insurance.
Okay.
So the seed money is coming from the government.
You have the estimated cost, what you think it would cost to set this whole thing up and get going?
Not offhand. Of course, it's a part of one of the studies, but I don't have the figures.
Carla, we hope to get the minister on, responsible for the subject, so then that would be a good question for him, if they don't know that. All right?
Well, we know that, but we don't have that information here with us, but we know the figure.
Oh, you didn't come with that figure in your head?
No, not at all.
That's how you told me you're ready for any question. Carla, thank you so much. You just exposed them. Appreciate the call.
You're a lot of fun.
But no, I mean, just recapping, you know, we got a few more minutes left. The bottom line is it's a good program.
Thank you.
And
Yes.
the idea behind it, the concept is great. We need it. But again, more and more questions, you know what I mean? And I'm sure you sound like you guys already thought about them. You already have answers prepared. So, you want to speak your mind? Go ahead, please. Hello, talk to us. A live show.
Hello, yeah. For instance, somebody moved to the Highlands on a work permit, contribute for 10 years, and they decide to go back. Is anything refundable?
No.
Everything is dead right here.
No, it's nothing is refundable.
It's not like Social Security. It's a program that you put into and you use it when you need it. It's available to you as long as you're contributing.
It's now for now.
It's now for now.
Right.
Yes.
So don't put a whole bunch of money. Don't use it when you get sick, you know. You understand, Carla? If you're going to contribute, make sure when you're sick, utilize the program. That's the whole idea. Again, ladies, we're looking at probably 10-15 minutes. Just not give us a final word, but anything that you want people to know. You see, when you have good people and good thing on to talk about the phone blowing up. You want to speak your mind? Go ahead, please.
Yes, good evening.
Hi.
Evening.
Yes, hi. Speak your mind.
Hi. You speak in your mind. Go ahead.
Okay, I'd like to ask, the health insurance, does that cover dental also? And if it does, what percentage?
It's proposed to cover dental and vision,
Yes,
and it'd be a set fee per annum.
Yes.
A set fee per annum.
a set fee. So if I go to the dentist, this is what I want to know. Would it cover, you said a certain percentage though?
Yes, there'll be the copay, whatever that the copay is.
Okay. All right. Thank you very much.
Did I answer your question?
Hello?
Did I answer the question?
Yes, thank you.
You're welcome.
All right, thanks a lot.
Okay. All right.
Well, one of the things I think that will come out with all of your various meetings is that we have Social Security on the one hand, we have the pension. Go ahead, Sam.
You want to speak your mind? Go ahead, please. Hi, talk to us.
Yes, good night to everyone.
Good night to you.
Good night.
Yes, my question is, suppose you somebody who always traveling, like you have to travel a lot, and while you're overseas and you get sick or anything happen to you, will you recover or you're on vacation?
I know, I realize I'm going to be a little rude, but you weren't listening.
I want listening?
You weren't listening. We just covered that. All right, let the ladies answer no.
Maybe I went to the room and I did.
You went to get a glass of water. I'm glad to know that at least you're tuning in, but let the ladies them answer. Don't hang up yet. Wait.
Okay.
Yes, you will be covered for emergency care overseas. Yes.
Especially if you're on vacation.
As long as you're enrolled member.
The lady said as long as you're an enrolled member and you're contributing, you're up to standard, you're up to date, you're covered.
And
Okay, thank you.
additionally, ma'am, we would would want all our listeners to know that the ID card that will be issued to all enrolled members will have those emergency contact numbers that are essential to making sure that you can access coverage.
Well, that's something you need to emphasize. I mean, when I had my insurance plan when I was living in the States, I had a book.
Yes.
In that book, every state by state, country by country, if I had a problem in this state, I just flipped the book, bam.
Yes.
Joe Blow's available. This is my problem. He's the available practitioner. So people will have that information once they enroll. They'll have that booklet. They'll have those contact information. They're good to go.
Yes, right. A booklet of the benefits of the plan will be issued to all enrolled members, and the necessary contact information will be there in order to facilitate the access to medical services.
Well, somebody wanted to know if they had a heart attack and they needed to go off the island via the air ambulance. Coverage?
Yes.
Coverage, yes.
Yeah. So
horses are not going to be worse off than that. In our opinion, what is proposed, you're going to be much better off.
Absolutely. You want to speak your mind? Go ahead, please. Hi, talk to us.
Yes, good evening.
Good evening.
A young lady just called a while ago and she was speaking about having a baby overseas without any special condition and stuff. They said that you wouldn't need an insurance. But we have insurance right now, and we're able to go to Puerto Rico, United States, and get big and have full coverage. So why can't we have the same coverage if we're paying the money into the scheme that is mandatory the same way?
You want to hang up and listen? Because I know this one going to be long. You have any other question you want to ask before you hang up? And then we'll...
No, that's basically it, because I know that we're having a coverage right now for that.
Yes.
The one that we take.
Yes.
If you say that the system is going to be so good and we don't need it, I can't understand why you have to be on special conditions. That if I want to choose to have my child in Florida, that I have to be paid at the rate of people's hospitals. You know, if it's going to be good, then it should be matching.
If it's going to be better. That's why we like callers like you.
Right.
Okay.
One of the goal of the National Health Insurance is to build resources for continued improvement in our health services. And if we continue to export the resources, the financial resources, then we're going to defeat the purpose. So that's one of the major goals, to provide resources for improvement of health care. We're not telling persons that they cannot go. We're not telling them at all. But
I think it's important to listen to what that caller said and what the other caller said. There's some things in there that you just now exposing that may be a challenge to special cases. For example, that's just by choice, like we said. They choose to go off island to have their child, but they can have it here and they'll be fully covered. I think that's clear for the viewers to understand that. That's your choice. But the other caller said, my coverage right now, with, let's just use, for the lack of one, Bupa. It doesn't matter. I can go wherever with Bupa and I'm covered.
Having spent some 20-something years in private insurance industry, I can safely say, confidently say, that most of the issues with normal pregnancies off island is due to a lack of confidence in our current healthcare system. And earlier we did indicate that the NHI is part of a facilitation to building the healthcare services. The HSA are steadfastly working to build the current healthcare system. So we want the community to understand that there are improvements on the way that will be on par to those services that you're traveling off island to access. So it won't be immediate because it's a work in progress, but what will happen is that we will have equivalent services on island as those off island.
Okay, good.
That speaks to accreditation, though. Are you going to, as part of your program, are you going to institute an accreditation program for the hospitals here? The clinics and hospitals?
No, an insurance company doesn't necessarily accreditate a hospital.
No,
the hospital is going through an accreditation process right now, which is separate to the National
Health Insurance. Conversation when we get back to that. Yes. Carla, you want to speak your mind? Go ahead, please. You have a question? Oh, they hang up. Yeah, go ahead.
Yes. The hospital, the Ministry of Health has instituted some major health reform.
All right, hold that 1 second. Okay. You want to speak your mind? Go ahead. Talk to us. You have a question?
Good night.
All right.
Yes. I wanted to know from either of the two ladies if either of them plan to have additional insurance while they're enrolled in the NIH. I'm going to hang up and listen.
No, ma'am.
Absolutely not.
That's a confident no.
Absolutely not. No.
Carla, you're too slick for your own good. What do you mean if they're going to get somebody else while they're getting this so good insurance plan? Ladies and gentlemen, we got a few minutes. They haven't really given us the indication yet, so I guess we could continue. But it's good. The conversation is good. There is still a lot of question. Yeah. But again, before they start blinking us, you guys, yes. Is there anything we missed that you think it's important to bring out there to the people?
Not anything that we missed so far, but we want the public to be aware that this is a work in progress. We want your input. We are anxious actually to have your input into this National Health Insurance Program. We have begun a series of community meetings, and so far the feedback has been positive. Persons have had many questions, those of which we were able to answer, some of which has taken us back to the drawing board in terms of the suggestions made by the community. For this week coming, we will be in Road Town on Tuesday at the Noah Lloyd Positive Action Movement
hold
Park.
That right there. Road Town Tuesday, Noah Lloyd Action Park.
Wednesday at the Stickit.
Hold that thought. You want to speak your mind? Go ahead, please.
Yes, good night.
Good night.
I only got a question I'd like to ask about that National Health Insurance you're talking about. How that normally pay, or how it's going to be paid?
Carl, I'm going to tell you the same thing I told the rest of my other good viewers all good viewers to this lovely show. You weren't listening.
No, I'm just following.
I realize that. You weren't listening. Anyway, let the ladies answer because you're important, Carl. And we know you got a lot of people in your household. I don't even know who you are. I'm just assuming.
No, it's very important that I ask this question because
absolutely.
The reason why I asked it.
Go ahead, ladies. How do they pay? How do you enroll?
You will register with the National Health Insurance. What is being proposed would be a set percentage of your salary. Your employer will deduct it from your salary and the employer will match it. It'll be a 50%.
But let me ask you a question again.
Yes.
Because it's very important we deal with this. Now, in the name of goodness, right? I am not against National Health Insurance, but in the name of goodness, we've been paying a portion of taxes. We've been paying a large portion of Social Security. Now you're going to be asking us to pay another large portion of National Health Insurance. I would like to find how we are going to tie that into a job. If we have a job that we already tender for, how are we going to tie that in? Because it costs us money. Where the money is going to come from, where we are going to find it to pay this thing. It's a very important question.
It is
look at it that way.
It is a very important question, and that's one of the considerations that we take. That's one of the points that we taken into consideration when I spoke earlier about the August deadline. We realized that August might put a burden on some persons because they haven't had a chance to budget for it. So that's one of the consideration that we looking at.
Not only that, talking about self-employed people who might not be collecting salary. They got to do a job to make money so they can get something. Now, I have a little problem with Social Security where that's concerned. Now, listen to me careful. I don't want nobody to take me wrong. When a self-employed person go to pay the Social Security, they might not be able to pay every month. They could only pay when they collect money. Why should they pay a late fee? Now, they're paying for themselves, they're paying them own alone. And if you pay late, they're still telling you that they're late fee. Why that shouldn't be? That shouldn't be. Because they don't cost money like they pay the ordinary workman them.
That's an anomaly. I agree. That's an anomaly because it's not a monthly rate. It's not a monthly pay.
But I can't agree with you, Mr. DeCastro. One of the things that we have in the BVI, a lot of us do not plan. If you know that you're going to have 6 months of employment and 12 months of expenses, you spread it out. We have to learn to plan, not for today. And we as a population, we are bad planners. So if the law says you pay by a certain time, because when you file a claim with Social Security, we don't want to get sidetracked. When you file a claim, you expect to be paid on time. So you have to pay the contribution on time.
I think you might misunderstanding a little piece of what I'm trying to say here.
Okay.
Let me go back over that again with the self-employed person. If the self-employed, now most of the time a contractor does not make money. People believe a contractor walk with a truckload of money. It don't happen. Because I know what you're talking about. Sometimes you do a job and by golly, when you don't pay money, you ain't got a dime coming home. When you don't pay bills them. And if you can only afford to pay it every 3 months, why should you have to pay late fee? Shouldn't be. It should not be. Because it's a lot of strain.
I hear you, but I want to also say, and I think we're getting a little sidetracked. The law says that you pay the 5% surcharge, but I don't know what has been your experience, but what we do at Social Security, that as far as possible we administer the law in the spirit of the law rather than to the letter of the law. And if you have that an arrangement, because we ask to pay in advance, but if it is that you sit down with one of my inspectors and say, this is my situation, I can only pay every 3 months, and you keep to that, I am certain that you won't have to pay that late fee.
What happened if you don't get a job for a year? What happened if you don't get a job for 6 months? What happened? Where are you going to get from to pay? These are the things that I bring up.
Okay.
Carla, we're going to hope to have these lovely ladies back on the show again. And please, 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 I'm back on the show so you can start tuning in from 7:30. We appreciate the call. It's a wonderful question. It's a really important question. You're right. It goes to...
The same way we got to pay this money. These people who got working for you should be able to save them money to pay their own bill.
Yeah, we agree. We agree. Well, thanks a lot, Carla. Thanks a lot. We do have to wrap up. They're telling us to wrap up, but please tune in next week, huh?
Yeah.
All right. Ladies, folks, we're not taking any more calls. We're done. We're going home. We're going to let these ladies wrap up. Courtney and I are going to say our piece. And then next week, we're going to continue this conversation with the, what do you call the folks from the hospital again? The Health Services Authority. We're going to have Ms. Baptiste, I believe. And hopefully Mr. John Klein going to be on, and we're going to tear them up the same way. So we want you guys to tune in, because again, healthcare is very important. Ladies, give us some, just be real brief. If anything, we can always bring you guys back, because the show has been very informative tonight. Give us something quick that the people may have missed, didn't understand.
Well, we are here because, like we said, it's a walking process. We want to thank the public for calling. We want to thank you for having us. And we want to encourage the public to come out to the public meetings. If you have a question that you didn't call in, and you weren't sure of the answer, and we didn't answer the way you wanted it answered, you can call us at the Social Security Board, and we'll be happy to take your question.
Very nice. Okay. Madam?
I also would like to thank the public for their contributions this evening and their continued participation in this proposal stage of the National Health Insurance. We welcome your feedback, we invite your feedback, and we would want to also inform the community that the community meetings continue. We will be on Tuesday, 7 o'clock at the Noah Lloyd Positive Action Movement Park, Wednesday 7 o'clock at the Stickett, and Thursday Hunter's Gut on the basketball court at 7 p.m. Please come out and make this an interactive approach to your NHI. Thank you.
Your security for a lifetime.
Yeah. Well, Sam, you know, I can't say much more than we've had a really good show, and we've had some very good interaction from the public. The viewing public have really spoken their mind. They made a lot of calls and made a lot of texts, and I think we'll hear more about the program as as the program develops and we have more community meetings and people begin to understand the impact of the scheme.
Definitely.
And that's pretty much, you know, where we're at this point.
All right, so ladies and gentlemen, again, I just want to thank everybody for being a part of this show. Obviously, whenever we have lovely ladies on stage, y'all want to call. Y'all don't want to talk to when it's just me and Courtney for some reason. And I must say something about this text. Somebody texting, the only question is, where's Rye Berry? You got two beautiful ladies and you asking for a man, you have to be a woman. You better be a woman asking for Rye Berry. Where we have ladies on our stage, don't ask for no man. Okay?
But I think we need to answer that because
Yes.
Mr. Barry is the deputy director directly responsible for the NHI, and he would have been here, but he had an emergency.
And we weren't expecting him. I was told that he was coming.
He had an emergency, so not that he didn't want to see you.
Not me. He wanted to come and answer your question, but
he wanted to be here, but he could not be here.
That's right. That's
so
right.
when you invite us back, I'll make sure he's here.
Definitely. Well, the floor is open. We want everybody to know the floor is open. Anybody that have things of importance that the public need to know, this floor is open to them.
Sam, you should stretch it from the government side, from the opposition side.
Courtney, I put the conversation out to the two politicians that want to debate. This program is open for that. Government official knows they could come on this show. I gonna be nice to you. Courtney gonna be nice to you. He nice anyway, but I gonna be nice to you. Come on the show. The people want to hear from you. They don't want to hear from me. I can't speak for you. But ladies and gentlemen, listen, it's been a wonderful experience. I hope we could do it again soon. We do have a lot of people scheduled. They want us to be a Speak Your Mind show, so we don't want it to be a interviewing show, but at the same time, this is what matters to the people of the territory, and we got to keep doing this kind of stuff. So, ladies and gentlemen, with that said, I just want to again thank everybody for the text. I didn't get to some of the text because your texts are long. It's easier to just call, take your 3 minutes, say what you got to say, hang up and give somebody else a chance, than for me to every 5 minutes trying to read a text and 4 and 5 texts back to back. But we appreciate the text, we appreciate the call. Until next time, God's willing, we'll see you again.